Thanks everyone for joining this afternoon, and welcome to our department's weekly grand rounds. So today I have the great privilege of introducing Dr. Katherine Napalinga. She will be talking to us about psychiatry and AI, which I think will be a really exciting session. So let me go ahead and start with the introduction. Dr. Katherine Napalinga, MD, is a dual board-certified child and adolescent psychiatrist and faculty member of the Jefferson Einstein Medical Center, Philadelphia Psychiatry Residency Training Program. She holds a certification in artificial intelligence and healthcare from Harvard Medical School, underscoring her commitment to integrating cutting-edge technology with psychiatric practice. Dr. Napalinga has extensive experience in various clinical settings, including inpatient, crisis, and outpatient programs within the Einstein Healthcare Network, Belmont Behavioral Health. She has also held the position of Associate Medical Director of the Einstein Crisis Response Center. Her expertise has been sought by local and international media outlets, such as the Philadelphia Inquirer, 6ABC, Fox News, WHYY, and the Philippine Daily Tribune. Dr. Napalinga's clinical interests are diverse, focusing on mood and anxiety disorders, autism, ADHD, and the intersection of psychiatry and technology. She is particularly passionate about promoting accurate representations of psychiatric issues in media and literature. She is a strong advocate for evidence-based practices, emphasizing the importance of combining psychopharmacology, psychotherapy, and interventional and integrative modalities to enhance recovery and improve patients' quality of life. Dr. Napalinga earned her medical degree from the University of the Philippines College of Medicine. She completed her residency and fellowship training at Albert Einstein Medical Center and Drexel University, where she served as chief resident in both programs at Drexel and Hahnemann University. Additionally, she was a Doximity Fellow from 2015 to 2016 and continues to contribute as a member of its physician panel. She also recently has joined faculty at the Tower Health Reading Hospital Psychiatry Residency, working as a child and adolescent psychiatrist at their outpatient clinic. And with my great pleasure, I'll turn to you, Dr. Napalinga, now for our Grand Rounds presentation. Thank you so much for being here.
Thank you so much for your generous introduction, Dr. Sauer. And again, thank you for having me. So without further ado, I will share my screen. And I just wanted to make sure, does everyone see and hear me clearly?
Yes.
All right, wonderful. All right, so today we're going to talk about a very relevant topic, which, whether we like it or not, is in our face today. And that's artificial intelligence, but I'm going to narrow it down further for something more relevant to all of us here, which is AI and psychiatry. So, hold on. So our objectives today are to understand the fundamentals of AI and its applications in psychiatry, recognize the potential benefits and limitations of AI in mental health care, and explore the currently existing AI tools and technologies used in psychiatry and explore its future directions. So the goal is to give you a comprehensive understanding.
Yes, that just goes to show never give up.
The goal is to give you a comprehensive understanding of how AI is transforming the practice of psychiatry. So, all right. So before we can move forward and talk about artificial intelligence, we first need to define what intelligence is, which can be kind of a tricky and slippery slope. Now, the early pioneers of AI believe that their creations were on the cusp of human-level intelligence. However, AI is an elusive concept because intelligence itself is difficult to define even for humans. So it's a complex and multifaceted concept that has been studied and debated upon by psychologists, neuroscientists, philosophers, and educators for many years. Generally, though, we accept that it refers to the ability to learn, understand, and apply knowledge and skills to solve problems, adapt to new situations, and comprehend complex ideas. And so we face the same set of challenges when evaluating artificial intelligence that we do when we evaluate human intelligence. The most we can say right now is that AI seems to be working pretty well in some limited domains. However, we should be upfront about some of the caveats that accompany these claims. All right. So, artificial intelligence is commonly defined as the simulation of human intelligence processes by computer systems. Now, AI systems are designed to perform tasks that typically require human intelligence. So, examples of these are learning, problem solving, and decision making. Some key concepts in AI include machine learning, neural networks, and natural language processing. So, I will talk more about what these things mean as we go over some of the slides together. So, machine learning, as illustrated here, refers to the development of algorithms that allow systems to learn and improve from experience without being explicitly programmed. And we may have seen some iterations of these in the movies and TV shows or the books that we have read. So neural networks, from what is implied in the name, is a type of machine learning that is inspired by the structure and function of the human brain. So as you can see here in the illustration, some of the concepts here, some of the diagrams here kind of remind us of our own neural connections. And then natural language processing, or NLP, is the ability of computer systems to analyze, understand, and generate human language. And some of us in the room here may have already experienced some of these through our cell phones and our computers. All right. So let us shoot back in time and look at the history of AI in general, so that we can glean a better understanding about its applications in our field of psychiatry. So the concept of artificial intelligence began all the way back in the mid 20th century, and the pioneers were Alan Turing, who is shown here, and John McCarthy. So Alan Turing was a pioneering computer scientist and is considered the father of modern computer science. His seminal 1950 paper, entitled Computing, Machinery, and Intelligence, posed the question of, can machines think? And this later laid the groundwork for AI research. So if you want to learn more about Alan Turing, watch the movie Imitation Game, which is great. And then the other pioneer shown here is John McCarthy. So he was a professor at Stanford, and he coined the name artificial intelligence in 1955. He helped formalize the concept of common sense knowledge in early AI systems. Now, these early pioneers laid the groundwork for the field of AI, and they posed questions about whether machines could think and laid the foundations for future advancements. Now, while limited by the computational power and data available at the time, the work of Turing, McCarthy, and others set the stage for the rapid progress in AI that we see today, especially in fields like our own. So in the summer of 1956, there was a conference called the Dartmouth College Conference, which was a defining moment in the history of AI, because it was here that the term artificial intelligence was first coined. And from these beginnings, several key developments over the next several decades laid the methodological foundations for the AI systems that we have today. So in that conference, leading computer scientists and philosophers such as John McCarthy, Marvin Minsky, and others came together to discuss and define the new field of artificial intelligence. And this meeting set the stage for future developments. In here, they envisioned machines capable of performing tasks that typically require human intelligence. However, the attendings of this conference did not fully grasp the magnitude of the challenge. In written documents of the time, we can see that they thought that this project would only take one summer's worth of work, and yet modern computer scientists and other professionals are still working on this as we speak. So the following year, in 1957, a machine called the perceptron was developed by a psychologist and computer scientist at the Cordell Aeronautical Laboratory. His name was Dr. Frank Rosenblatt, and the perceptron was one of the first algorithms that was capable of learning from data. And this marked a significant milestone in the development of machine learning. The perceptron was a groundbreaking neural network designed to model how the human brain processes visual information. So basically, it connects a web of points where decisions are made, and then these points or these decision points come together in the larger program, and then they solve the more complex problems. So, Dr. Rosenblatt optimistically envisioned the perceptron as a machine capable of mimicking human abilities such as walking, talking, seeing, writing, reproducing itself, and even being conscious of its own existence. Now, his vision encapsulates this era's optimism and belief that human level AI was an imminent reality, and this notion has persisted throughout the field's history. Despite the perceptron's limitations, it laid the foundation for the more complex neural network models that underlie our modern AI systems. So the perceptron is considered the simplest form of a neural network and serves as the foundation for more complex models. It learns to make decisions by adjusting the weight of each decision based on data that is inputted, and this process is crucial for building even more sophisticated networks. So another way to explain how it works is that it takes multiple binary inputs to produce a single binary output. Now, each input is assigned a weight, and the perceptron calculates the weighted sum of all these inputs. Now, then this sum is passed through an activation function, which is also called a step function, and then this activation then determines the final output. So fast forwarding to decades later in the 1980s, this was another highlight in the history of AI because powerful new algorithms were developed during this time, specifically backpropagation and convolutional neural networks. So hold on, sorry. Backpropagation was introduced in a breakthrough paper by the professor shown here, who is Dr. Geoffrey Hinton. He and his colleagues allowed complex neural networks to learn efficiently from data, and this revolutionized the field and laid the foundation for today's advanced AI systems. So basically, Backpropagation is a training algorithm used in neural networks to minimize errors during learning. So it works by adjusting the weights of the connections between the neurons based on the network's prediction error. So initially, the network makes a prediction, and then the error is calculated by comparing it to the actual output in reality. So backpropagation then propagates this error backward through the network, adjusting the weights to reduce the overall error. This is not unlike the way we learn, in which, we learn from our mistakes basically and correct our actions in the future based on our experiences in the past. So this iterative process is repeated until the model's predictions align closely with the desired outcomes, enabling the neural network to learn and improve its performance over time. So the other prominent scientist in the 80s was Dr. Jan LeCun. So Jan LeCun pioneered convolutional neural networks. So these are specifically designed for processing visual information. Now, these networks have become indispensable in computer vision, powering AI systems for tasks like image recognition and object detection. So these functions, like I said earlier, you have experienced these personally because of your cell phones and other systems that you might have been exposed to. So the rise of these algorithms in the 80s marked a major turning point in the development of AI, paving the way for the systems that we have today. All right. So AI's journey in healthcare started with the simple rule-based systems that we talked about in the 50s and more prominently in the 70s and the 80s, which were designed to support clinical decision-making. So from the get-go, AI was aimed at supporting medicine and healthcare. So as computational power and data storage capabilities improved, machine learning and neural networks began to emerge further in the 90s. And by the early 2000s, AI applications like IBM's Watson showcased the potential for AI to diagnose and treat diseases, supposedly. So the transition from paper-based to electronic health records over the years has created the need for a more efficient, productive, and accurate way of processing healthcare information. Now, Plato could have not put it more succinctly in that necessity is the mother of invention, because this then catalyzed the current incarnations of AI applications in healthcare. Today, AI is transforming various aspects of healthcare. Modern AI systems leverage vast data sets and advanced algorithms to provide insights and support that were previously unimaginable. So fast forwarding to the last decade, we see two distinct phases that have revolutionized AI and its extended impact beyond computing into broader scientific disciplines. The first phase, which we will refer to as the supervised learning era, which was from 2012 to 2017, was characterized by large models trained on extensive labeled data. These models were designed for single tasks, utilizing specialized computer chips known as graphics processing units, or GPUs, for large-scale applications. So this era marked significant advancements in challenging domains such as image recognition, and we saw big advancements in the use of AI for diagnostic medical imaging. So in the illustration here, we see several vegetables, and basically the model is trained to recognize and sort the vegetables into their proper names or labels. So then 2017 onward was the era of self-supervised learning. And these models do not require labeled data in the traditional sense. And so they emerged as generalist AI systems capable of tackling a wide array of tasks. So this shift allowed us to move beyond mere prediction models and enabled us to answer questions that were previously hard to even articulate. So in short, the models were actually trained to infer from previously learned data. So one notable example from the self-supervised learning era is our current chat GPT. So as we can see, we still have the vegetables, but the machine has now learned how to sort the vegetables by itself without the training that was included in the supervised learning area, where the computer scientists or the trainers had to teach the machine the labels of the different vegetables. Oh. So generative AI has revolutionized how we create and interact with digital content. Now, these advanced machine learning models can now generate original text, images, audio, and video. So examples of these are GPT-3, now GPT-4 for language, and DALL-E for image synthesis, and they're considered very transforming industries. So generative AI can now produce remarkably lifelike and coherent content, blurring the line between human and machine creativity. And so this opens up unprecedented creative possibilities across entertainment, marketing, medicine, and beyond. So as an example, here I used an image model um, to change my college yearbook photo. I was in a band back in college, and the AI model actually made it into a video, which is shown here. So it basically created like a Harry Potter like photo for us, where it made the photo come alive. All right. So now we move to our field, which is what applications does artificial intelligence have in psychiatry? So we will be dividing them into four because these are where most of the applications are aggregated. So we will talk about diagnostic tools, therapeutic tools, monitoring tools, and predictive analytics tools. So diagnostic tools, AI algorithms analyze diverse data sources such as speech patterns, facial expressions, and social media activity to detect signs of mental health disorders like depression and anxiety. For example, AI can now identify subtle changes in a patient's voice that may indicate a depressive episode. And I'll go into more detail about these studies later too. So therapeutic tools. So here, AI-driven chatbots and virtual therapists use the principles of cognitive behavioral therapy and other therapeutic interventions, principles, and techniques. So these tools make mental health support more accessible and can complement traditional therapy. Monitoring tools. So here, wearable devices and smartphone apps equipped with AI can track physiological and behavioral indicators, offering real-time monitoring and early intervention for patients at risk. Now, these tools can alert clinicians to potential issues before they can escalate. And then in predictive analytics, AI models predict the likelihood of mental health crises, enabling proactive care and timely intervention. Now, this predictive capability can help in tailoring personalized care plans for patients. So all these tools are actually in place now and can be downloaded by our patients. So it's also good to be aware of them and maybe try some of them out yourself just to see how they work. Um, they are currently revolutionizing mental healthcare by making care personalized, efficient, and accessible. So let's talk about um, another example of how AI significantly enhances diagnostics in mental health care. Traditional diagnostic methods often rely on subjective assessments, which can lead to variability in diagnoses. AI, however, can analyze large data sets from various sources such as electronic health records, speech patterns, and even social media activity to identify patterns indicative of mental health conditions. For example, in this study published in the European Physical Journal of Data Science in 2017, it was demonstrated that machine learning algorithms could actually predict the onset of depression with an accuracy rate of over 80% by analyzing Instagram social media posts. So, this level of precision helps clinicians make more accurate diagnosis, ultimately leading to better patient outcomes. So, what's shown here in the picture is the kind of filter used by the Instagram user, and they found out that people who are likely to be depressed use kind of the darker or bluer end filters, whereas people who didn't end up being depressed used kind of the warmer filters. So okay. So in personalized treatment plans, mental health conditions, um, sorry, hold on, let me just correct this. So as I mentioned, AI can improve the creation of personalized treatment plans. Mental health conditions are complex and manifest differently in each individual. So we can't approach it with a one size fits all kind of approach. Now, AI algorithms can actually analyze a patient's unique data, such as genetic information, um, lifestyle factors, and treatment history to tailor therapy specific to their needs. So a notable example is the use of AI in optimizing medication plans. So what's illustrated here is a table from a research paper called the Co-Med study. This was published in the Journal of the American Medical Association in 2017. Here, AI-driven models were able to predict patient responses to antidepressants with greater accuracy than traditional methods, leading to a more personalized and effective treatment regimen. So basically, the study explored how machine learning can help predict which depression symptoms improve with specific treatments. So the researchers first trained a machine learning model using data from patients who took the antidepressant citalopram from the study trial. So it was a previous study that they used as a reference. They then tested this model on new patients from their study who received different treatments. And then the study found that the machine learning models could accurately predict changes in emotional symptoms for patients taking either escitalopram with a placebo, and also venlafaxine with mirtazapine. As you can see, the p-values here are pretty small. So the models also successfully predicted sleep and insomnia symptoms for those taking escitalopram and bupropion. So very clearly significant differences from the other arms of the study. So the study concluded that common tools used to measure depression can identify reliable symptom groups which respond better to different antidepressants. And choosing the right medication for these specific symptom groups can actually lead to better outcomes than simply choosing an active drug over a placebo. So now let's go to predictive analytics. So AI's predictive analytics capabilities are currently revolutionizing early detection of mental health issues. By continuously monitoring data from wearable devices, smartphone apps, and other sources, AI can identify early warning signs of mental health crises, such as relapse in patients with bipolar disorder or schizophrenia. For example, in this study that was published in Neuropsychopharmacology in 2016, they found that AI algorithms could predict manic episodes in bipolar disorder patients up to 24 hours before they occurred, which allowed for timely interventions. So, this proactive approach can significantly reduce the severity of episodes and improve overall patient management. So, they did this basically by tracking the quality of phone-mediated communication patterns in the different patients in the study and how these patterns changed over time. So they found that the patterns belonging to the patients who were having manic episodes were different from the controls that they had. Um, so now let's talk about accessibility. So in many parts of the world, as we know, there is a shortage in mental health cares in mental health care professionals. And this severely limits access to care. Now, AI-driven tools like therapeutic chatbots and virtual therapists can provide immediate support and intervention, making mental health care more accessible, especially in underserved areas. Now, for example, in a study published in JMIR Mental Health in 2017, the AI chatbot called WHYY has been shown to reduce symptoms in anxiety and depression in users. And these tools are available 24/7, offering support when human therapists may not be available. So we can see a clear difference between the information controls and the reduction in symptoms in the PHQ-9 with the users that were using WOBOT to help them out. So, and this was just 2 weeks later from their baseline. So, in conclusion, AI is poised to revolutionize mental health care by enhancing diagnostic accuracy, personalizing treatment plans, enabling early detection of issues, and increasing accessibility. Now, as we continue to integrate these technologies into clinical practice, we can look forward to a future where mental health care is more precise, personalized, and widely accessible. So now let's look at some statistics and trends regarding AI's adoption in psychiatry. So in a 2023 survey of psychiatrists affiliated with the American Psychiatric Association, 44% of psychiatrists had used OpenAI's ChatGPT 3.5, and 33% had used GPT-4 to assist with answering clinical questions. And just out of curiosity, how many of us here have had a chance to interact or use AI? Just a general show of hands. Or if you don't want to use your video, you can just use the emoticon on Zoom. Yeah, so I'm glad to see a lot of hands being raised up here, but it looks like our numbers are still echoing what the APA has found, maybe a little more than what the APA has found. So generally, administrative tasks were cited as a major benefit of these tools. 70% somewhat agreed or agree that documentation will be more efficient with the help of AI. 3 in 4 psychiatrists, or 75%, somewhat agreed or agreed that the majority of their patients will consult these tools before seeing a doctor. 9 in 10 somewhat agreed or agreed that clinicians need more support or training in these tools. Okay. Let me just close some windows. So, oh, sorry. So a report by Accenture in 2022 predicted that AI health applications could save the US healthcare economy by up to $150 billion annually by 2026. And that's just next year. So the global market for AI and mental health is also projected to grow at a compound annual growth rate of 38.3% from 2021 to 2028, though frankly, I would not be surprised if the percentage ended up higher than this. AI-driven mental health apps have seen a 400% increase in downloads since 2020, reflecting growing public acceptance and reliance on these technologies. So these statistics highlight the rapid adoption and significant potential of AI in our field. So what are some current AI tools and technologies used in psychiatry? So right now, as we've talked about, AI is transforming mental health care, offering new tools for diagnosis, therapy, and monitoring. These tools are used to aid in identifying mental health conditions, leveraging AI-driven therapy or support to provide personalized data-driven treatment. And then they also allow for continuous monitoring of mental health indicators. So in this screen, you'll see various apps belonging to the diagnostic, therapeutic, and monitoring and administrative category. I actually looked up what their ratings were. So some of the concerns that were mentioned in rating the usability or reliability of these apps were credibility, user experience, and transparency. And just looking at the tracking devices or apps and also the chatbots, it looks like so far, and I don't know if something has surpassed this by now, but it looks like Wobot won the ratings as far as credibility, experience, and transparency. So, and like I said, feel free to investigate and experiment with these apps just to see how they work. And you can download them from the App Store of whatever interface you're using. So, so I did mention credibility, transparency, and trustworthiness as potent concerns in the use of AI. So some limitations and challenges that have been mentioned are data quality and bias, integration with current systems, interpretability, and patient privacy and security. The data that's used to train AI models can be biased, reflecting existing inequities in healthcare. So because of these biases, this can sometimes lead to the perpetuation of these biases in the AI's outputs. So these limitations are also things to keep in mind if you ever become active in developing a model using AI, because these biases can actually be overcome as long as you are conscious about them and correct them in the system when you are training the model. So second, it's vital that we can interpret how the AI algorithms arrive at their decisions. So this interpretability is crucial for ensuring the ethical use of AI and building trust with patients and clinicians. So third, any AI tools we implement need to be compatible with our existing healthcare infrastructures and systems. Effective integration is key for successful deployment. Now, these integrations are already going on, and the last that I heard of was Microsoft working with Epic in integrating AI into the EPIC electronic health record system. So finally, protecting patient privacy and the security of sensitive data is of utmost importance. So AI applications in psychiatry must adhere to strict privacy regulations and HIPAA. Now, addressing these limitations and challenges will be critical as we explore the potential of AI to enhance psychiatric care. Other ethical considerations include obtaining patient consent, as we said, ensuring bias and fairness, being transparent, and being accountable. So it is actually required that you inform a patient that AI is being used either in scribing their interview or in generating their note or in the use of diagnostics when you engage them in treatment. So addressing bias in AI algorithms is also essential to ensure fair and equitable treatment. And transparency in how AI is being used is vital for building trust and accountability. Now, determining responsibility for decisions made by AI systems is also crucial for ethical practice and ensuring patient safety. Clear accountability measures must be in place. And because of these concerns, the myth that AI systems are going to replace us is actually untrue because, right now, AI does not have the capability to ensure these and need human controls to be able to ensure that these considerations are in place. When, for example, you use AI to make a draft of something you're writing, or you use a scribe to transcribe your interview, you also make sure that that the output of the AI that you're using is correct and accurate. And without us human beings to guarantee that, all hell will break loose. So, what are some future directions in AI and psychiatry? So, it holds great promise in research and development, integration with other technologies, and policy and regulation. So, integrating AI with other emerging technologies such as virtual reality and the Internet of Things can create innovative solutions for mental health care. Also, developing clear policies and regulations around the use of AI in mental health is crucial to ensure ethical and responsible implementation. Now, these three areas will be crucial in shaping the future directions of AI in psychiatry. Speaking to policy and regulation, I know now that a lot of journals have an active policy that people who write papers must disclose the use of AI in aiding the writing of the paper. Not that it would disqualify acceptance of the paper, but they just require disclosure. So, in conclusion, AI offers significant benefits, but we must also carefully navigate important ethical considerations that it raises. AI is evolving rapidly, and its role in psychiatry will only continue to grow in the years ahead. As AI continues to be more integrated in our field, we must remain vigilant about key issues like privacy, bias, and the responsible development and deployment of these powerful tools. The future of AI will also require ongoing collaboration between clinicians, researchers, ethicists, patients, computer scientists, and technology experts, and law and policy makers to ensure that these technologies are used in service of better patient care and the greater good. All right. So I just have my bibliography. And if you want me to share these slides with you also for further reference or reading, I can actually do that. I can post the link in the chat as well. So we still have some extra time before the Q&A. One of the things that I also have traditionally done is a demonstration of an AI scribe. So I will actually need to ask for a volunteer. Have all of you ever used AI scribes before? Like, how many people have used AI scribes in the room yet? I just wanted to see a show of hands here. Okay. Not too many. All right. So prepare to be amazed is all I can say. But yeah, I guess um Dr. Towen, I'm not sure if you're volunteering for our demo or if you wanted to ask a question.
No, actually, I had raised my hand of having used AI, but thanks
Oh,
for asking.
perfect. Perfect. So
I'm going to
maybe
lower it now.
yeah. So, but yeah, yeah, and weren't you like super amazed when you first used it? I know that was my reaction. But yeah, who wants to volunteer as my demo patient for like 4 minutes? It'll be a super short interview. So the scribe that I will be using is actually not released yet. It's the Doximity scribe. So because I was a Doximity fellow, I was allowed to beta test some of these applications. But scribe you can also find on what's the name of this? Medscape. So scribe Medscape also has the same model scribe that's used in Doximity. So if you want to experiment with it just to see how it works, grab your friend and use them as a sample patient, you totally can. But yeah, do you want to volunteer Dr. Sowar as my partner to interview?
Sure.
Actually, you can also
Sure.
interview me if you want for like 3 minutes.
Okay, that sounds good. I'm
Do
happy to
you
do.
want to be the interviewee or the interviewer?
Why don't I'll be the interviewee if you want
All
to.
right. All right. So we'll pretend you're one of my patients in my med management clinic.
Okay.
And so I will start so basically Scribe doesn't record, it doesn't keep any of your records. So it transcribes as you speak. And in that way it's HIPAA compliant. So you still need to sign a business associate agreement when you use Scribe, but for the most part it doesn't keep any of your records, and the transcription is only kept for I think 5 days, and it gets, it's abolished basically. So you need to write your note immediately also because it will be erased. All right, so we'll start the interview. So I'm pressing the scribe now. All right. Hi, nice to see you today. What brings you to the clinic? You weren't due for your appointment until I think 2 weeks. What's been going on?
Hi, thank you. Yeah, it's been a really hard week. It's been a couple weeks of just feeling really anxious and uh, lots of worries, especially with the turn of the new year.
Oh, I'm sorry to hear that. How have you been sleeping?
Thank you. Yeah, sleep has been also pretty tough. I've had a hard time staying asleep and just having like lots of kind of nightmares and kind of scary thoughts waking me up in the middle of the night.
Oh no, it really sounds like, this time has been difficult for you. So, anything stressful going on that I need to know about?
Yeah, well, that's what I've been trying to figure out is like, why is this happening at this point? Some might be like anticipated changes coming up, I think, for me during the new year. But also we had some family movement and I just moved into a new house, and so few
Hmm.
life changes.
Any one of those alone are enough to cause, significant stress. So scale from 1 to 10, as far as sadness goes, 10's the worst, 1's the best. Where would you say you are right now?
Probably at a 7 today.
Gosh, oh my gosh, that's so high. What about anxiety? Same rating scale from 1 to 10.
Yeah, I'd say probably the same, like a 7.
Oh, wow. I'm sorry, but let's see how I can help you. With that 7, there haven't been any dangerous thoughts, right? Like there have been no thoughts of harming yourself or
Right.
others.
No.
Okay, okay. Yeah, thankfully. So we'll do our best to improve those numbers for you. Now we started Prozac 10 milligrams the last time you were here. And I said that if there was no relief from what you were feeling, we would be bumping it up a little bit more. Were there any side effects at all with the Prozac that we started?
I've felt pretty good with it. I had some headaches the first few days, but I don't know the medication caused anything. So I've been feeling okay with the Prozac.
Okay, wonderful. And that's usually how it goes. It's just the first few days and your body gets used to it. So now are we okay with bumping the dose up a little more to 20 milligrams? Is that okay?
I'm hopeful it will help. I'm okay to increase it if it might help with some of the stressful feelings that have been coming up.
Okay, so let's do that. And you had no trouble filling it, right? Your pharmacy was able to dispense it when
Right,
you were
thankfully.
there. Okay,
Yes.
great. Yeah, and you did the right thing. Even if it's not your appointment yet, just call us and have an earlier appointment if you have, any issues come up or if you need our help. Okay?
Thank you.
And therapy is good. You're still seeing your therapist weekly, right?
I missed, my therapist was out for the holiday. So I missed a couple weeks, but I will see her next week, which should be good.
Okay, I'm glad to hear that. All right. So how about like I said, we're increasing Prozac to 20 milligrams, and then let's see each other again in 2 weeks and see how things go, okay?
Okay, thank you.
Awesome. Okay, bye. All right. So now I stopped the scribe and you can actually customize templates to kind of echo your style of writing things, which is what I did. So it only takes scribe 2 minutes to transcribe the whole thing and write a note. And so that's what it's doing now while showing me a calming picture of kittens playing. Sometimes they put jokes on there. So I'm using my cell phone to scribe, and then you then go to the Doximity website.
No, Dr. Napalinga, are we supposed to see that? Because we see your thank you slide.
Oh, okay. Hold on a minute. So let me stop this share. And so now it's writing the note on my phone, but I will start sharing my Doximity screen so that you can see the transcription. Just give me 1 second. Let me just log on to Doximity. Oh no. Okay. Yeah, so worst case scenario, I can copy and paste the note in the chat so that you can see the kind of note that Scribe wrote. So just bear with me. So while I'm doing that, actually I'm gonna open the floor to any questions that you might have for me so that we can make good use of time. And don't forget to copy the CME code on the chat window as well. Hello?
It looks like Dr. McIver has a question. She has her hand up. Hi, Dr. McIver.
I do. I took myself off mute. Thank you. Hi, Dr. Napalinga.
Hi.
Hi, you mentioned one platform that Scribe currently integrates with. I think you mentioned Epic. Is there a list of other platforms that they have already integrated with?
Sadly, no.
That's the
But
only
I'm
one.
sure, I am confident and willing to bet money that that's the direction things will be going.
Okay.
But it looks like Epic is the one that's leading the way where that's concerned.
Okay, thank you.
But yeah, independent platforms, like I said, Doximity's doing it, Medscape is also doing it, are using AI, or at least offering AI to help us with our tasks.
And we in student health, perhaps one of the more broadly utilized platforms in collegiate health is Medicat. And so I'm curious about, and that's what we use here, I'm curious about whether or not there's a plan for that integration.
Yeah.
Mhm.
Dr. Soar might be a better person to address that question.
Yeah, no, I think it would be a good opportunity for us to kind of evaluate the systems that we're using and what I know we have. Dr. Nakeep, unfortunately, is out today, but I know that he's been keeping a pulse on a lot of different AI evolutionary opportunities. But yeah, specifically for MedCat, I know I don't know too much more about the AI options right now.
Okay, but I mean, I guess it's a good thing that it's taking me forever to get to my to get to my note, because it's asking for double authentication and all of that with facial recognition. So that's its way of guaranteeing that I am the one pulling up the note and everything. So now it's ready and I can share it. All right. So all right. So this is the note that AI generated from that brief conversation, and it literally, like, I did not generate any of these. Like, it literally wrote a whole SOAP note. But of course, I didn't dictate any of the mental status exams. But if you wanted to, like, if the patient left and you wanted to say, if you wanted to dictate your mental status exam, then it would generate like a paragraph of mental status in there. But yeah, I mean, looks legit, right? So I mean, yeah, so that's why I was amazed when I first came across it. And if you want to try it out yourself, even not using the scribe, just like in your, if you have an AI app like ChatGPT, I know Viber has its own AI, but type something like generate a progress note for I'm child, so I'll say a 14-year-old patient presenting with ADHD, and just see what AI writes, and even that will amaze you. Like just a generic note for whoever, and just to see like the power of our current natural language processing models, as I said. Yeah, I see a question from Dominique Price.
Hi, yes, I guess I'm wondering like about with this kind of AI software, I assume you would need the permission from the patient.
Yes.
And then potentially with something like the one that you use, the Doximity one, buy-in from your department, right?
Yes.
Okay.
So yeah, so of course we all need to go through all the hoops that we usually go through, and obtain permission. But let's say you were a private practice doctor who who you don't have to go through all that. The rules right now are you have to inform the patient that you're using an AI scribe, and also say that it's a HIPAA secure scribe, and none of their information will be kept on record on the scribe. So that's the current protocol.
Thank you. And then there's just one question in the chat, Dr. Napalinga, about if patients can use this to do self-treatment with biofeedback.
I can imagine that could be one application. I mean, Wobot already has, I think, some kind of biofeedback integrated in there. Although its primary, I guess it's the main thing it's espousing is that it uses CBT guided techniques in its functionality. So, but if you use with the biofeedback, actually, the wearables are the ones that will give more concrete biofeedback. Also, the new ring, I think, and I think iWatch is also working on something. I wouldn't be surprised if Fitbit jumped into the wagon too. So, all right. Any other questions?
Okay, well, thank you so much for your time this afternoon, Dr. Napalinga. Thank you for the presentation and for all the information on AI. And yes, if you want to share your slides, we'll be happy to distribute and share resources with the group.
Okay. Thank you so much, Dr. Sower. Thank you everyone for having me today. It was a pleasure. And I'll send the slides to you as well.
So, okay, thank you so
All right.
much. Take care, everyone.
Bye.
Thanks. Bye.